functioning infrastructure was the main problem for most Somalis. The new sporadic initiative made by the Somalis in the diaspora that is intended to re-establish some form of social services like schools and hospitals are bearing fruits. Those services are now introduced to many places in Somalia, from sub-locations to towns, districts and cities. So, small towns like Derri, which locate somewhere near Albur district, which lies south-central Somalia, is not an exception. Meanwhile, Derri locates roughly 300 kilometers from the Somali capital Mogadishu. The town enjoys the newly built school and hospital, mainly with the help of the donations made by the people from this town who live in the diaspora. This is the Derri Hospital's acute department, which deals with the day-to-day basic needs of the patients who are coming from far and wide every day, even if the hospital has no capacity to cure their respective ailments due to lack of enough specialists like doctors and nurses, thanks to lack of adequate financial assistance from the people who are trying their best but fell under par in terms of giving concrete financial help. Anyway, they are trying to make the cut, but it is quite obvious that it is a big ask for them, so it is only right and real they need more help from anyone who can help. The daily patients of the hospital fall different categories. Some of them can't get the medical care they need from the hospital, so they are sent to Mogadishu to get better medical attention. Some others are divided in patients who stay in the hospital for a period of time until they finally feel fit and fine, and outpatients who always go home when they receive further medical assessment and get medicated. The main obstacle of the hospital is lack of sufficient specialized doctors, so it will be like fighting a lost cause when it comes to dealing with many diseases and medical problems, as the folk are flooding from faraway places. And above all else, the hospital has no enough medicine and equipment which needs to be dealt with as soon as possible. The hospital has also a MCH section which can solve simple pediatric and gynecological needs of the hospital. There is also a midwife who deals with a childbirth and giving nutritional consultations to the pregnant woman in order to deliver a healthy babies so as to be the best way possible when the time comes. But the concern is the hospital cannot feed its patients. As I said earlier, there is a people who are coming from other parts of the country who don't have close relatives there. So now even the locals are trying to fill that void, but it is never easy, as they can't withstand that economical burden.
kuma meel fogba ilaa uma beegsoba habeenkii socodmiya harkii mahaseexanba ayaan kuma meel fogba ilaa uma beegsoba habeenkii socodmiya harkii mahaseexanba.
This is Dr. Harun Noor, who is the only real doctor of the hospital, who is talking about their lack of giving enough and efficient medical service to the people in need, who are coming from districts and regions hundreds of kilometers away from Derri, which do not have similar facilities in their own towns and districts.
This child becomes our hospital 2 days before in the from the recently the area surround the area of Delhi, complying with diarrhea, vomiting. So he was AWD, acute watery diarrhea. We give fluid replacement. So you see his eyes become well instead of what was ward. We have more patients in this ward, so they have different diseases. As you see, this يعني this has abdominal pain, crepitation, cough, fever. Our hospital complying with diarrhea also. So as you know, this word is ward. So they have different disease. So this is acute watery diarrhea. Also, this patient comes from the surrounding area. 64 years old man, complying with cough, night sweat, fever, dyspnea. So we suspect it to be lower respiratory tract, especially TB. So we give the TB treatment. This man also comes to our hospital in the area, complying with polyuria, polydipsia, and polyphagia. So we suspect DM. So we confirm that he has diabetic. So still in our hospital, continue treatment. This man also comes to our hospital before 3 days as an emergency. So you see this condition now is well, but he was unconscious for the traumatic. He fall in the wall, so he became unconscious. He is good, but he was emergency. Thank you very much.
In many aspects, the hospital has to be expanded soon because the people in need and the services in place are not directly proportional. There is medical equipment that was sent by the diaspora communities, but now that equipment is still in Mogadishu as the current building doesn't have enough space to house them. Even the hospital generator has no reliable room, so it is vulnerable to the wind, rain, and other external forces, etc., etc. The local elders and some of the residents of Derri town are showing their gratefulness towards their country's comrades in Europe and elsewhere, who gave them the opportunity to get medical care while being at their very hometown, Derri. The other phenomenon which needs to be addressed here is how these people are showing their readiness to make their own contributions as much as they can, so they can use the old strategy called give and take. Somalia has the potential to stand on its own feet again, as Somalis are now more than ever understanding how can they be the real people who can solve some of the society's most chronic problems, like rebuilding important institutions like schools and hospitals. Mohammed Haji Hussein Rage, Gothenburg, Sweden.